So I just want to welcome everyone to our event called Digital Transformation in Healthcare. My name is Tina. I'm from the Assembly of European Regions. We are the largest independent network of regions in wider Europe. So we represent about 150 regions throughout wider Europe. So I'm actually really happy that today we have three regions represented. So we have Spain, Slovenia, and Scotland. So three S's. But we'll hear a little bit more about what they do after in a little bit. Right now, just wanted to give you a little bit of background of why we're here, what we're going to be discussing. So at AER, one of the things that we do is that we do knowledge transfer and knowledge sharing. So this is one of the key things. We bring regions together to discuss different aspects. And one of the main things is digital transformation in healthcare, or specifically digital health. So to lay a little bit of the background for you, I want to reference a study done by McKinsey and Company regarding digital transformation in healthcare. So as you can see, that one of the things that was mentioned in this study is that governments have a role to play in instigating digital transformation in healthcare systems, meaning that the regional, the local, they're the ones that can really maybe instigate this change. And there's some more information about the NHS in England and what they're doing, and how IT structures can really, with public services, really instigate the change of the digital transformation in health. And lastly, how healthcare organizations that promote open innovation will help spur digital transformation. Today, we are going to be talking about digital transformation in healthcare, the mutual exchanges, what regions are doing and what organizations are doing to try to better their healthcare system. And for one of the main topics for us is integrated care. This is a very patient focused theory of how healthcare systems are changing. The topics that we want to discuss today includes the following. So we want to talk about aging, international collaboration, as well as collaboration with other stakeholders, best experiences and challenges related to digital transformation and knowledge transfer, health and care services, and public services, and the changing role of regional government. So first, I want to have the speakers introduce themselves and gives you a little bit of feedback about what they do, their organization, and you'll hear a little bit more. So I'll leave the floor, I guess, Stuart, since you're closest to me.
Okay, hi, I'm Stuart. Wow. Okay, I'm Stuart Anderson from Scotland. I'm an academic, but I work quite closely with the healthcare system in Scotland, and I've been quite active in the European Innovation Partnership on Active and Healthy Aging. I work in a project called Sirocco, and then Sirocco Exchange, which is around transfer of good practices from region to region, so it's a kind of innovation and scaling up activity. But I also do work in polypharmacy, looking at excessive prescribing, and also on wearables and digital infrastructure in health systems. So that's my kind of area of work.
Can, yeah. Hello, my name is Liliana Madrid. I come from Slovenia. I am president of the Development Council of Cohesion Region Western Slovenia. Our main competencies go to the implementation of cohesion policy and other development issues, and of course representation of the region abroad and in Slovenia. But this is voluntary part of my work. I am employed as the directress of the development agency of Ljubljana urban region. This is central part of Slovenia, the most developed one, and we are coordinating the development of 26 municipalities, including the capital city, Ljubljana, also green capital of Europe 2016, and next year, Velo City. So what we are doing, we are detecting potentials, development potential, and ensuring sustainable development. So everywhere I'm in development focus, so development goes for people, for quality of life, and I think that's reason good enough that I'm here today. So I'm glad that I can share some experiences with you.
And Christina?
Hi, I'm Cristina Nadal. I'm a physician. I'm medical oncologist. I have been doing this. I have been attending cancer patients for more than 15 years. I'm also professor at the University of Barcelona and have experience in basic research. And for the past 4 years, I have been occupying a position in the Department of Health as the director of the healthcare area in the Servei Català de la Salut, which is the Catalan health system, and also which is the payer. But I have also been the policymaker for some time. And now I have moved to innovation. I'm at BioCat. BioCat is a private public foundation which is interested and mainly focused on fastening the innovation. They are mainly focused on medtech and biotech. And my goal or the goal of the BioCat with this incorporation, of my incorporation, is try to solve 3 problems that we have with innovation in Catalonia. One is the access of innovation to the public market. The other one is try to orientate all the innovation to the needs that have the professionals, but also the citizens. This is something that we always talk about this, but it's not solved. And also try to use some actives that we have in our system, like information, big data, images, whatever, to try to do nice projects and optimize all this innovation that we have in the public healthcare system. So.
Thank you so much. So the first thing I wanted to touch upon was aging. This is one of the big factors that is why integrated care is so important and is being basically developed and scaled up. So as you can see on the slide, I mentioned the B3. Stuart, you also mentioned this regarding how the Scirocco Exchange is part of this B3 action group in the European Innovation Partnership on Active and Aging, Healthy Aging. So it's basically a collaborative network of partners from over, as you can see, 260 stakeholders. So all different administration, national, public, private, who are trying to work together towards integrated care system. The reason why this is so important is because a recent report by the Aging Working Group of the Economic Policy Committee showed that by 2070, there's going to be a drastic decrease in the number of people working in the working population, because it will be a decrease of population, but the decrease of the working population will drastically be also decreasing. Spain is not going to be affected as much according to the study. There will not be an increase in the GDP, but Slovenia and Scotland, for example, will be affected by more than 3%. They will be spending more than 3%. So, of course, this is a very important topic to our regions because, of course, if you're going to be increasing the amount you're spending on GDP, you want to know, is there ways that we can battle this before we hit this point? So I would like to invite our speakers to maybe give us some best experiences, what you're doing to try to help battle this problem. I know in Ljubljana, there's this active aging report. But of course, I'm open the floor to anyone who would like to provide their experiences and what they're doing.
Maybe if I start, Tina, because you mentioned Ljubljana. Yes, Slovenia is going to be faced big changes in population. So if we are talking in terms of aging population, if today the ratio of people older than 65 is around 18%, in 2057 it will be 31, and I think that we all can estimate what will this mean for the future. So we have to be prepared for these happenings, for us and for coming generations. So I would say that Ljubljana is providing a lot of diverse and innovative services for the elderly people, much more than it is needed to do by the regulations in Slovenia. So Ljubljana Council adopted two age-friendly Ljubljana action plans, one for 2013-2015, and the second is still ongoing to 2020. And there are around 100 different actions. So I will just point out some of them because I think they are maybe interesting and to share these practices with you. So if we are talking about social care, I would point out daily activity centers for the elderly. There are 9 these centers in Ljubljana, and they are every day visited, each of them by 30 to 100 people. You can imagine what this means on daily level, on yearly level. So they are opened from the morning till the late afternoon. And they are free of charge, or people pay just a symbolic amount of money to be there, because services are provided also by the elderly people, students, or unemployed, and the rooms are provided, of course, by the city of Ljubljana. Then there are special programs for people with dementia and their relatives. We know that dementia is something that we are facing today, and it will be much more intensive even in the future. Then there are programs aimed at preventing elderly from falling. Ljubljana is investing a lot in sports activities, so we have a lot of outdoor fitnesses, and sports society is completely free of charge, and is co-financing activities like yoga or swimming lessons for the elderly, and so on, many of them. Then there are various educational contexts. There are really a lot, but from photography lessons to dancing lessons to foreign language lessons. But I would point out one, it's a really big one about literacy for the elderly. From 2007, Ljubljana is providing free of charge lessons for literacy, for digital literacy, for people elderly than 55 years. These lessons are going on 3 days per week. They are completely free of charge. They can educate at basic, intermediate, and advanced level. And in all these years, there was more than 15,000 of people who took these lessons. And Ljubljana spent more than €1.5 million for this education. And last 2 years, we have also info point for the elderly of 65 years and also disabled people in Ljubljana, so that they can get all the information on one place. Then I think that it's needed also to mention that there are programs for housing needs for the elderly. And one specialty is the Council for Elimination of Architecture and Communication Barriers. It is mayor's consulting body, and they work really intense for more than 10 years, and Ljubljana was 3 times awarded for City of Accessibility. There are many inventions also in public transport and in pedestrian zones closed for traffic. You can get free of charge e-vehicle. There are 9 of them going on in the city center. So and Ljubljana is developing new and new services because Ljubljana is member of different associations. And I think that this is really good practice to provide more than is regulated, and to do so much for this dignity of people. And I think that today it's nice, if you are older, it's nice to be in Ljubljana. It's quite human city. Maybe such much for the beginning.
But it really showcases that in order to battle aging, there's many different facets that you need to tackle, which I think is some things that we've been talking about here. With you mentioned earlier about how I believe we spend a lot of money on social care, at least in the UK. Could you maybe go in a little bit more detail about this to the audience, perhaps?
Yeah, I'll say a little bit about the European Innovation Partnership and Active and Healthy Aging. It brought together about 300 different agencies across Europe, and the idea was to try to transfer good practice from one health region to another in order to help scale up. Yeah? And one of the key areas of work is integrated care. So that's integrating between the medical system and the social care system. Yeah? In the UK, we have a budget of around 200 billion or so on health and social care, and around 45 billion of that is spent on assistance for daily living. That is helping people just get washed, keep their house clean, do their shopping. So roughly between 20 and 25% of expenditure goes on social care. Yeah? It's one of the least productive sectors in Europe. I think the value add is something like 12 or 14 euros per hour. Yeah? In addition, there's about 100 billion pounds worth in the UK of informal work that families do. So if you value the informal carer, then that adds another 100 billion to that 45 billion. So roughly speaking, if you look at the effect on the economy, then roughly we have 150 billion going on looking after people in order that they can do things. So there's a real need for innovation. The need for innovation is in order to transform the productivity of that sector. And the productivity of that sector will change the better it integrates with health. Yeah? Because what we want this sector to do is to be well trained enough and capable enough that it stops transfer into the more expensive health sector. Yeah? So we want prevention to be happening here. We want healthier living to be happening here. And there's lots going on, as you heard from Slovenia, all over Europe. Yeah? But the question is, how do you scale up? So the Sirocco project that I work on and the Sirocco Exchange project, it introduced the idea of a maturity measure for health systems, where what that would do is it would let people say, how mature is my system to adopt a good practice? Yeah? And then we also were able to look at the good practices and see how they depended on maturity in the health system. So in other words, you could match good practices with health systems. So we produced a small tool and some process for people to arrive at what their maturity level was for their health system. That was a consensus process that brought lots of people together. So there was a across the boundaries meeting to agree it, and that was one of the critical things. And we translated it into many languages, because one of the major obstacles in these tools is that if you don't work at the local language, the good practice will never sink in, yeah, because local languages are the way that health systems work. We're all Anglophone, you're all listening to me in English. I'm monolingual in English. But it's really important because lots of people are monolingual. So that's one of the main obstacles that we think we overcame. And we have about 60 health systems in Europe using that now. And the way that these things are worked is if you have similar levels of maturity, you can look at twinning. Yeah? If you have different levels of maturity, you can look at a coaching relationship. If you have a particular good practice and you want to try to move it to somewhere else, then you can start talking to the originating group and say, how can we move this to here? Because moving something is not simple, because the infrastructure is different. It's a different health record here from here. Yeah. So how do we move it? So that's a big challenge. And so the Sirocco project is about helping those things to happen, because the critical thing about innovation, for me at any rate, is how many people use it. We have lots of novelty in medicine. People are coming up with new novel things all the time, and then nobody adopts them. Yeah. So the critical thing for innovation for me isn't so much. I mean, talking to some medics, they say we've got enough novelty to keep us going for 70 years or 80 years or 100 years. The problem that we have is, how do you get people to adopt? How do you get people to change practice? How do you move from a relatively static public sector to a public sector which is dynamic and adopts in the way that private sector does? And maybe Christina might want to say something more around this sort of stuff.
Yeah.
Because BioCat and...
Yeah, that's the goal that we have. Thank you. So as it has been said already here, so older people, or the population is getting old. This means that we have a lot of more people that is getting sick, and they have more demands. But not only on the health perspective, but also on the social perspective. So that's really a challenge to try to go with that, right? So here in Catalonia, we have a lot, the experience with lots of years with different projects focused on the old population. As you were saying, I mean, I can start talking about different projects, but as Scotland was saying, I mean, the challenge is not having projects that work and that are nice, but to try to scale these projects up, and at least from the Catalan perspective, is like incorporate all these evidence, all these projects that have proven to add value to the citizens, incorporate this to the public market. This is one of the major challenges, and this is not solved here. So that's one of my missions in BioCat, to try to scale up all these initiatives that are good. So I'm not going to spend time talking about all these initiatives, but I would say that from the administration point of view, one of the nicest things that we are doing for this older population is trying to connect all the clinical records. As you know, the different health institutions have different systems, and sometimes it is a big challenge or a big difficulty to go ahead and to have information from different patients that move through all the system. So from the past few years, and we have connected the system, the clinical record system that the primary care have, which is called ECAP. We have connected this system to the hospitals. All the hospitals are already connected. We are talking about a system that is being used for all the primary care, more than 369 places, which are connected to our 70 hospitals, acute hospitals. And now this system is also connected with mental health and also with the hospices. So this is a great value, which perhaps we cannot measure now, but it's for sure an investment for the future and for these old people, because all the information can be shared. And moreover, here in Barcelona, we have a 2-year-old innovation, which is connecting all the clinical records with the social records. And this is huge work, because they are worlds that talk in different languages, but we thought that this was really useful. So we have many people going to give some social support to our elder people at home, but these people don't know about the clinical situation of these people. So we have found that this initiative is very beneficial for not only for the citizens, but for the whole system, and decreases the cost. So I don't know, we can talk about this a little bit more, but I prefer not to explain more examples.
So we've talked a little bit, Stuart, you mentioned about the Sirocco Exchange and how that's a mutual learning, basically to scale up the system in different regions. So I thought it would be interesting for us to talk about the importance of international collaboration or collaboration with other stakeholders, as well as some challenges that you face. You've already mentioned the fact that the language is a barrier. I mean, we think of the Anglophone society, but of course, when we're trying to scale from, let's say, the Basque country to Scotland, then we might have to translate either from Spanish or Basque into, so it can obviously become a very complicated way. And that study done by McKinsey that I had referenced earlier, they mentioned that there were three main barriers. They don't find the technology as a barrier in digital transformation of healthcare. What they find the barrier is culture, governance, and the organizational structure. And of course, if you would like to maybe expand a bit, I know you mentioned that you think there's another aspect of challenges, but the floor is yours just to talk about this topic about collaboration.
Well, okay, so I can say something about organizational issues. So there's a thing in call centers, yeah, and it's a phenomenon called failure demand, yeah. And when call centers were first introduced, not in health, but just in general, the failure demand was something like 70%, which meant that actually only 30% of customers were actually making a first call. Because what they were doing was they were coming round, yeah, and coming back because they weren't being dealt with properly on the first call. Yeah? Because we have siloed services, because the police service is different from the social service, is different from the health service, we do not know how to measure failure demand in the health and care system. And I was talking to one of the leaders in the emergency care, and I asked him, what is the most important measure you would want to have in your organization? And he said, I would like to know the failure demand. Yeah? And so we cannot measure that right now because actually the police keep records, social service keep records, health keeps records, and we don't have a way of watching how people bounce from one to the other. Now we work with a National Health Service Trust in England that has introduced an integrated thing across social services and health services. They looked at their Hot 100, yeah? Those were the 100 patients that were costing them £10 million a year to service, yeah? So that's a very significant spend per capita, yeah? They discovered that half of them, roughly speaking, were mental health patients. And they were mental health patients who had a crisis because they got a bill they couldn't pay, yeah? So they had a psychotic episode or a whole range of things, and they bounced from service to service to service to service. They could track it, and they can see. And the point at which you can start to measure like that is the point where you can make a change. So digital transformation requires integration, because health, just siloing, let's look at fixing this person, yeah? It's a black hole. You can keep pouring money in there as long as you like. Because as people get older and people get more stressed, yeah, then what you see is the rise of mental health problems and the rise of the problems of old age. And if we want to have a sustainable health system, we have to put a bottom on that. And the only way to put a bottom on it is by measuring and then taking measures to control costs. So that's my...
Yeah, I totally agree with what Scotland says. I think one of the challenges is that to remove the fear that we have to change things. So when I work on the health department, they know I didn't want to hear, we have always done things like that, because it's, so let's change that. Let's change, please. So, for example, what he was saying was really interesting, because we have plenty of data of the contacts that the patient has with the system, but we are not able to track the loops that the patient is doing in the system. So that's the most important thing, not the number of contacts, but if this patient and the process is being analyzed, can be improved, can be optimized. So when there are softwares that can do this. I mean, this is not a technology problem. I think the challenge is that we have to be convinced that we need to change to optimize and to keep being sustainable. And that's a culture problem, a resistance to change problem. And that's probably what is more difficult to change. And apart from that, which I think is really important, I also think that technology sounds interesting to everyone, like digital health sounds interesting to everyone and to the administration too, but it's not really a prioritization. It's not seen as something that can change the way of how we are doing things and can help us to manage things better. So the concept of prioritize all the digital health is not still um, enough established in administration. So I think these are two challenges that are pretty major.
I agree with both of you. I was talking, presenting you this good practice of Ljubljana. And in the city we have one budget, there are departments, but we have one mayor and he is very good decision maker, and so when decision is made, doesn't matter which departments has to collaborate or some institution. But on a national level, we have problem. Our health system is not sustainable, our pension system is not sustainable, and long-term care is not institutionalized like it should be. Competencies are going from the Ministry for Social Care now to the Ministry of Health Care, and services are dispersed, regulated in different regulations, and financed from the different budget. But we all pay taxes and contributions. For me or for anybody, it's not a question which budget will pay these services. So I think this cooperation and understanding is really a big problem. Yes, and digitalization as a tool, understood as a tool, but as a priority is really important. And with this, I think it's really for the older generation important, this digital literacy, so that they can use these services and that they adapt to all the changes that these rapid changing times are bringing.
So it's kind of going back to collaboration, but as I had shown in this study about healthcare organization that promotes open innovation will help spur the digital transformation. So this is really directed at you, Christina, because with BioCat, one of the things today actually, they have an open innovation forum taking place just a few kilometers north of here. And so it's very interesting to be able to see that your organization is collaborating with other private organizations. Could you maybe explain a little bit about what it is and just a little bit more in depth about BioCAD and this open innovation ecosystem?
Yeah, thank you. So the DNA of BioCAD is made of this idea of doing things together. Okay, so it's a public-private foundation, and the stakeholders are very different. So we have the government here, different departments, mainly health, but also also we have economy. We have many different departments, but it's like 49% it's government. But we also have other type of stakeholders like private industry. We have also innovation organizations and associations. We have universities, we have research centers, we have all these people governing these institutions, right? So for us, this is a letter of intention, like this is how we work. We cooperate, we co-create, we collaborate together to build up projects. This is the nice part. And we really have been, BioCAD has really been, has doing great in this collaborative approach, right? Specifically connecting the private part, like the industry, with research centers. But still, they have a lot of work to do in connecting the private world with the healthcare world. I mean, all the professionals and all the knowledge and potential of innovation that the healthcare system has. On the other part, I would say that in this type of organizations, many people is there because you have to be there, not because you really believe that you are going to do something great there. So we still have to improve in that way. And I'm talking, in this case, from the administration part. I mean, the government has to be there, is pushing and putting some money for these organizations working well, but still they need to understand that the goal of these organizations is crucial for the sustainability. So I don't think that they are enough aware of this.
So basically, you would say the government, so the government of Catalonia, is not completely aware of the importance of this, or because I think in Scotland they're very much integrated, that the government is very much pushing the healthcare agenda. While would you say in Catalonia it's not as much?
It's not exactly. Sorry if I give this impression. It's not that it's not involved, because the government is involved, and in the past 10 years they have doing economic effort to try to push up all these type of organizations. It's not that, but it's not all about money. It's about priority. It's about helping this initiative to crystallizate in the moment they need to go forward. I mean, it's not only about money. It's not really only about money. And in this, and I think the administration has to tend some bridges and strengthen those bridges to make these things happen. It's not only about sending money and budget.
So, I mean, I could say a little bit about some things that are happening in Scotland about this. So, in 2012, the government passed an act that said health and social care have to work together. It's called the Public Bodies Joint Working Act. It's got the most boring title, but what it did was it forced the existence of joined up thinking. Yeah, and it's taken some time, but just to follow up on what Christina said, what the Scottish government is trying to do, and Scottish NHS is trying to do, is to move private sector practices into the public sector. So there's a thing called the New Digital Platform, which is a digital platform for the social and health services, and that's being developed by a new team. The new team is led by the former Chief Technical Officer of Skyscanner, who's, I mean, it's an online travel site, yeah? And they're working in a completely different way. So they're not purchasing a big thing. They're working with open EHR as a starting point, and they're starting with an initial problem. So they've taken a particular initial problem. But the way that they're developing it is iteratively, so they're making releases maybe every 2 weeks with little increases. They're using DevOps techniques where they develop and they put it into operation quickly to get feedback. They believe that the trail that they get on the release trail will give them much better verification that the thing is fit for purpose. Yeah. The area that they're working on at the moment is not critical, is not a critical one, but maybe I'll say a little bit about that. So in Scotland, we introduced a thing called anticipatory care planning in 2008. And anticipatory care planning does risk stratification on the population to identify a group, and then says you need a plan because you're going to be sick sometime in the future. I mean, the most obvious ones are cancer, for example, where you know that 90% of the people will probably die in the next 5 years. So they have to plan. And most people want to die at home. And actually, from a healthcare perspective, dying at home is much cheaper than dying in a hospital. So what we saw in 2008 was a dramatic reduction in the number of unscheduled admissions. So the number of emergency admissions was going up, and then it started to go down in 2008. So it's a very good practice. But it was supported by a tiny ICT innovation, which was not accessible to all of the organizations. But what the new digital platform is doing is it's taking the process and it's making it open and available and understandable and manageable by all of the organizations that have to work together. So they can all contribute to the record, they can all see the record, and so you have the joined up thinking across the institutions happening through an open EHR system, which is being implemented using modern state-of-the-art commercial development techniques. And so this is a small team that's been pushed in. And in a way, I would say it's a little bit like the challenger banks back when the internet arrived. You know, the big banks created these other companies which basically ate their high-value customers. Yeah? And so in some sense, what this new thing is doing is it's introducing a new health record which is eating the customers, yeah, and bringing them into a more modern era. So.
And I think I saw that there's also an app that they can use where they can track how they're feeling, so keep themselves. So basically, the patient is basically inspired to know their own health. Would you say that's kind of?
That's not part of this project, but that's an interesting one. I mean, I think I do another project with another NHS trust on this. The big problem is what's the incentive? Because we want these apps to take care of the people who will have the worst health. If you look at the bottom 10% of socioeconomic grouping in Scotland, they typically will experience somewhere around 20 unhealthy life years. If you take the top 10%, they will experience about 5. Yeah? And if you look in cost, yeah, it's a massive cost, 20 unhealthy life years, especially when it's multiplied by 10% of the population. So but the thing is, that grouping, although they may have apps, and they may even have a smartwatch, it's very difficult. And I like to call them, lots of those people are the kind of unworried well, so they do things, yeah, which will definitely lead to illness later. But actually they don't recognize how to change practice. I mean, some of it is because of socioeconomic circumstances. Yeah. But the problem with things like wearables is typically 10, 20, maybe absolutely 30% will use them, and 70% they end up in the drawer. Yeah, I think 50% of Fitbits are given in December because they're Christmas presents, and about 50% of Fitbits end up in somebody's drawer without being used. So I'm very skeptical about wearables, because the other thing is, as a practitioner, Christina might want to mention something about this, is doctors hate the idea, because what will happen is somebody will come along and say, look, here's what my Fitbit says, and those are the worried well who are already very healthy, yeah? And the people who are sick, they don't come along at all. Yeah,
it's like a WebMD. When I self-diagnose, somehow I always end up with cancer. You know? So,
yep.
Yeah, that's true. So cancer is a paradigmatic disease in the chronic sense, and also because it's really a terrible disease. So it's a good target to test a lot of innovation and digital innovation. So one thing that I wanted to say, because you were talking about participating different stakeholders, apart from BioCat, I would like to say that from the payer, as a payer, we have had some experiences here in Catalonia which are very nice, and we're really moving forward to this, which is on the public purchase of innovation. We have done some calls with European grants with more or less 60 million of euros. And these calls are focused on covering some needs that the patient have on different fields. Chronicity, of course, is one of the major fields, but also mental health. And these calls look for partnering between the public and the private world, and also with different stakeholders, like different public institutions or different industries, whatever, to bring up solutions that are going to be purchased. So there's a compromise from the administration and from the public buyer that if this innovation brings you value, it's going to be bought in the near future. So I think it's a nice way to work. I would like to put an example. We were buying pacemakers for heart pacemakers, and we have a project in São Paulo Hospital which is being scaled up to different hospitals now. And the thing is that we partner with different industries that do these pacemakers, and now with the same money we buy not only the pacemakers but the to put the pacemaker on the patient and all the follow-up and repairing of anything. So all this is included in the same price. So we have done this with the private and the public institutions, and this is the way we want to pursue. So that's a nice way to establish a relation between the different stakeholders that have clearly many advantages for sustainability, for example.
And Liliana,
in Slovenia innovation, we have Slovenian Innovation Hub. It's networking different stakeholders from university to research institution, big company, pharmacy companies. But it's still at the very beginning, although it was now recognized by the European Innovation Hub as a site, because it is not supported financially by the government. So it works on the memberships, and it's difficult. It's more just networking that something very important for Slovenia. So we should get our law on integrated care this year and health reform next year. So we hope we have a really lot to do. So I think that you are good practice in Scotland and Catalonia, that we can learn a lot, but it's
nice
yeah.
to mix together. Yeah.
so I wanted to first, before we continue, check to see if anyone here has any questions for the speakers, if there's anything that's of interest to you to ask our speakers. I mean, they're all really knowledgeable about healthcare, digital transformation in healthcare, so we're always happy to hear your inputs as well. Okay, maybe not. Well, I do have a quick question though. We've been, I think in Europe we hear a lot about GDPR, and I think that with GDPR, the data, we've talked about data. Has this affected anything that you've been doing in your work in terms of trying to, I guess, transform the healthcare sector? In terms of, are there data that you can't use in the past, or are there limited? What's the limit now? Sorry, I'm now springing this upon you.
You want to start, Christine?
Yeah, I'm afraid, and I'm very critic with all the laws and all the regulations that are overwhelming, because they really obstruct the progress. So in the innovation field and on the data field and all this, I'm afraid we are start looping a situation that is not good for the innovation and for the exploiting the data and do nice things. So I understand that there has to be some regulation and all this, but at least here in Catalonia we are facing this problem. We are facing also the problem of the citizens that do not understand why we use the data to do different projects. We are dealing with many obstructions, which at the end paralyze the innovation. So I think the governments and laws and everything, not only on this field, but on all the fields, and you understand me, talking from Catalonia, are here to facilitate the development, not to obstruct this. So that's my feeling.
Okay, I think if you look, GDPR doesn't affect service improvement so much, because it all happens inside the National Health Service. So if you want to use the data to make a change in practice, then you can do it. The thing that's happened in research is much more carefully controlled. So my student who's working on polypharmacy, is working on prescriptions, she has to go to a data safe haven. Yeah, her R code has to be checked by the administrator first. She goes into a room with only a pencil and some paper. She runs her code on a machine in the room, and then she can make notes about the results. But there's no digital transfer in and out of the room. So from a research point of view, things are much tighter, I think, than they used to be. But from a service improvement point of view, it's still fine. Yeah, I mean, things are still good.
Still, the physicians and the nurses, and they keep on asking us how can we facilitate the way they work, and this ends up not facilitating this, but complicating it a little bit more. So I'm not sure.
I think there's a really interesting thing about data collected by healthcare systems. This was something that Christina and I were talking about earlier, which is, if you look in the UK, at any rate, typically lots of the performance measures are based on the processes. Yeah. So in the UK, if you're having routine surgery, you're supposed to have that within 18 weeks. If you have a cancer diagnosis, you have to start treatment within 2 weeks. If you go to an emergency room, you should be treated within 4 hours. Yeah, and all of the systems are set up this way to gather this kind of data. Yeah, but this is a massive stop on doing anything around process innovation, because the measures are linked to the processes. Yeah, the measurement has the process, and everybody is measured on that basis. Your success as a health manager is measured on how you hit the KPIs. And so one thing that is happening is there is a big shift in thinking about what we should be measuring. And maybe you might want to talk about PROMs. I don't know. I mean, it's,
about PROMs. We tried, as a payers, we tried to have some initiative to pay for outcomes and for experience too, because at the end you are focusing on the citizens or the patients, so their experience on the system has to have some value. And we introduced these PROMs and PREMs in the what we call the variable part of the contract with health institutions, and so it's very in the beginning, all this process, and we have started very smoothly. But it's, I mean, in a system that keeps on saying that we are focused on the value of health and the patient, which is in the middle of everything, I think that makes sense. So we have to start moving. This is like designing the tools to make the thing real. So I think it's a good way to move forward, like paying for results, whatever is the project. But we have to be very ready to measure the result or the outcome, and to make sure that we're paying for that result. I mean, it's not that easy. And the experience of the patient, for sure, it's the quality of the services and the experience of the patient is very important. So yeah, I think it's a good way to go forward.
And I think this is I think this is very interesting in relation to smart city, because certainly in Scotland now, people are working more and more closely with health data and administrative data. So in Edinburgh University, where I work, we have the Administrative Data Research Centre is co-located with the Public Health Centre. Yeah,
that's great.
And so they're looking at, actually, most of the innovations that you see in public health delivery have come from the use of administrative data, because you know how people are moving in the city. Yeah, and if you know this, then you can change outcomes for them. But sorry.
That's great. So I'm not so familiar with the health sector, but in my daily work, things are getting more and more complicated with collecting all these agreements for publishing data and publishing, I don't know, photos for this event. You should ask us if we agree. So the things are really getting more complicated, I would say, and for innovation, it's not a very good process.
And actually, this leads up into my next point regarding sharing information and data. Do you work with when you work with other stakeholders? Are you very willing to share this information? Are you open about this, or are you still like, this is my data, so I'm going to keep this data to myself? How are you working with other stakeholders? Would you say there's a mutual partnership, or is it more of a you want more from them versus the give and go?
Yeah, that's that's a complicated field. I would say that when we talk about sharing data, specifically when we talk about public data and private industry, um, the worst thing is that we don't have the same objective. So this is not sharing, this is selling data for, for another profit. Yeah. So I'm not, I don't think that this is the way to go. I think that sharing data, I mean, data is information. We are here to share. In the research field, many information is already being shared. So in the healthcare, we should be prepared to share everything, because this is progress, general progress that at the end will come as a particular progress, or the progress of your own citizenship. But one thing is sharing data for a common objective, and the other thing is selling the data for other objectives. So I would separate these. And why I'm saying that? Not only because of the purpose of sharing this data, but also because the citizens mix these two things. I mean, when you explain to the citizens that you have a lot of data, of health data, and you're going to use this to improve in research of any disease or whatever, they think that's okay. But when you say that you are giving this data to a specific pharmacy or enterprise, whatever, they feel that you are doing profit of their data. So, I mean, we have to start talking about this, and to openly talking about this with the citizens and take decisions and be very clear of what we are going to do with this data.
Yeah, I think the experience in the UK is very similar. I mean, we have this, we have a thing called Health Data Research UK, which that's specifically around genomic medicine. So that's looking at gathering information around the genome and trying to use it to inform pharmaceutical organizations in terms of new treatment, trying to understand the way the genome works. But if you say, well, shall we sell that data, then people become much more sensitive about it, even although it's anonymized. Yeah. So there are real issues around and sensitivities around these things.
I mean, there's no problem in giving data to a specific industry which is really willing to have products for a specific disease. I mean, there's no problem. But then, when I see the price of the product, I want to see a reduction.
Yeah.
I mean, so if we have the same objectives, which is battling against some disease, let's share things. But I think we don't speak these languages still. So.
But I mean, the other thing, how many of you are Android users?
Android?
Hands up. Yeah. How many of you look at your Google timeline? How detailed is it? How detailed is it? How detailed is it? Yeah, so it knows exactly where you ate. Yeah? Okay, so supposing Christina's organization said, give us access to your Google timeline and we'll tell you how healthy your diet is, yeah? Because we know where you eat. Yeah? How many people would feel comfortable about that? Good. But it's interesting when I mean, you are all giving your data to Google, yeah? Who use it to make the advertising right on your browser, yeah? But you're much more leery about physicians using that data to tell you how healthy your diet is. So so these sensitivities are
have
interesting.
to work on that.
Yeah.
But I would add, I agree with speakers, but I would add another dimension. So when we come from public sector and we work in European project, everything is public. So we often sell this information and results for free, and somebody else collect this data and then sell them for big money. So it's quite strange environment, and this regulation of European projects is a little strange if we compare it to other research or
Yes,
different projects.
it's funny because so at the Assembly of European Regions, we work with regional politicians. I can pretty much just Google their name, where they're located, and I can find their email and their phone number immediately. So just in case if you want to reach your regional politicians, you can find the data really easily and it's very open. But that was funny because as you mentioned with Google Timelines, I am the first person to look through and be like, yes, I was there. Oh, I was there. To let them know that, yes, this is where I was. So they know everything I do.
So you do work for Google.
I should. Maybe they're here. Hey, Google. I'm just kidding. Okay, so we're going to go back to healthcare digital transformation. Although we're here at the Smart City Expo, I always think that for me, digital health seems like it would be also very useful for the more rural regions, the places that might not have access as easily to doctors, healthcare, where they would have to drive maybe 30, 45 minutes to get to the nearest doctor. How does, and I know both here in Catalonia and Slovenia and Scotland, you have those areas that would be very rural. Are you, I guess, implementing this integrated, oh, sorry, it's really loud, integrated care in those areas?
Sorry, can you repeat the question?
Yeah.
I couldn't hear it.
So what I was asking is, have you been implementing either digital transformation in different sectors or in healthcare in the more rural areas of your country or of your region? Because of course, when I think of healthcare, I think, oh, it would be really useful for me not to have to go to a doctor if I had to drive 45 minutes to get there, for example.
If I can start, I would say that honestly, we were not so efficient as we would like to. So it's more difficult if you live on rural areas. So also the services are sometimes moving from some far districts to the centers, and it's not so easy for that population. But in the future, there is a strong idea in Slovenia about smart villages, not only smart cities, but smart villages. It's our member of the parliament who is running this initiative, and we believe that there will be quite a big amount of money available, and that we will bring the digitalization also to those rural areas where it is not sufficient.
Yeah. We have some experience, but it's quite difficult to work with different areas. But for example, for those people that do oxygen therapy at home, we cross the data with an energy department, and we see those that have poverty, a poverty situation, and we convince the energetic department to not to charge, yes, thank you, them for all these waste. So we have to improve a lot with this.
I think there's still a real infrastructure problem. I live 10 miles south of Edinburgh, and until recently, the fastest I could get was around 2 megabits, yeah, on my broadband. I now have a community Wi-Fi connection, which improves that a lot. But there's a whole lot about really how the infrastructure works. And then there've been quite successful pilots. I mean, I think one of the most successful ones is the virtualization of palliative care. So we did virtualized hospice, because people used to have to come into a center and then they'd be remote from their community and family if they were in the last stages of cancer treatment. But if you virtualize, then you can keep people in their own homes, and you can keep them embedded in their communities. And the doctor, instead of driving 4 or 5 hours to reach the patient, can speak to them over the teleconferencing. And actually, in the case of palliative care, that's quite successful. There do need to be people there to make interventions if necessary, but they don't necessarily need to be a doctor. And palliative care specialists are quite rare, scarce. So that's been quite successful.
But Tina, if I can, we had many discussions in Slovenia on this rural urban development and so on. And in practice, from far districts, some services are moving, not only health care and so on. And the people are not really happy. They say, yes, this digital health, e-health, it can be an instrument, but this is not something that is good enough as my doctor. So they still want to see their doctor. So this can be a part of service. I believe that there are also some pilots in Slovenia, but on the long run, people will not be happy with e-health only. They want their doctor. So this can be a part of service, I think.
But would you say this is a generational thing? Just because I'm going to take the example of banks, because I used to work for a lobbying company for banks, but they basically have certain bread and mortar buildings still, but they know that there's more elderly people who want to see someone. But the younger generation, they're like, it's okay, we can use the apps. We're very happy to just not go into the banks if we can avoid it, because we know it takes forever. So would you think it's really generational?
But in 2057 in Slovenia, there will be 30% people older than 65.
But maybe by then, those are like the people like me right now who, when I still am hoping I'm tech savvy by then.
It's necessary to go this way, but it's not enough. We still need a doctor who will shake my hand. And
Yeah, here in Catalonia we are developing some initiative in rehabilitation, not only in physical rehabilitation, but also in cognitive rehabilitation. So they have apps and they can connect, instead of going to a local in which a physician or nurse give you some indication of how you have to do this rehabilitation. They stay at home and they can connect and see all the exercises and this. And these are pretty extended in our system, so I think it's a good way to go.
I think we're getting close to, maybe if you guys have some final remarks that you would like to make about just in general digital transformation in healthcare. Where do you see it going in the coming years? Yeah, just basically what you see, or hopefully what you are hoping in the future.
Well, I think Christina will say more about this, but I think a fundamental thing that we have to look at is the sustainability of healthcare. Yeah? Healthcare accounts for around 10% of gross domestic product. So it's a huge portion. And it's mostly funded by public sector. And I think we have to see a dramatic change in the productivity of that spend. And precisely how to achieve that is difficult, but it comes down to how do we measure, how do we understand the way that the service is delivering, and then how do we optimize from that point of view. And I think the thing about digital and the thing about technologies like Internet of Things, for example, yeah, gives you a huge possibility to measure, yeah. But then you have to try to understand, and you have to have models in order that you can model effectively. And in order to do that, you have to do very dramatic things, I think, like really dramatically change the training of medical people, yeah? Because actually medical training doesn't really look at the use of digital at all at the moment. No. So actually we're training generations of people who are ignorant of the use of digital technologies in the optimization of healthcare delivery. And I think it may be changing slowly, but I think it's a real issue about the way we train and the current structures that we have, where it's very process-oriented. We measure processes, we don't measure outcomes. We can gather lots of data, let's try to measure outcomes and improve the outcomes for the spend. So that would be my story.
So maybe only a few words. I think that we should think about quality of life, and this means that also the elderly people in advanced years will have the choice to stay whether at home or to go to institution, and that they will get this integrated service. For this we need sustainable health system and sustainable integrated care. and I hope that we will be strong enough to create such systems, and that digitalization will be tool in all systems, tool that will help us to establish decent life in all systems. So this would be from me.
Yes, to close, I really think we are facing a major challenge, which is not only the sustainability of the social and health services for the citizens, but not only the sustainability, but the adaptation of these services to the expectations of the citizens and the changing situation. Like we talk about the people being older, so the reality is changing, so we have to adapt with the same resources, or more or less the same resources. So there's no other way to do that but changing and innovating. So we have to convince about this statement, not only to the administration, but also to the professionals and also to the citizens. I mean, they cannot say, I want to see a person, a doctor, but they can start feeling comfortable with a digital service, because if not, they are not going to have anything, or some of them will have and the others won't. So it's a matter of how we do this together. We have to be convinced that the only way to do it is changing and innovating, and the digital change is for sure one of the ways to do this.
So I just want to say thank you so much. I hope you enjoyed this session and we're able to get a good feel of the digital transformation and healthcare in the 3 different countries. So if you have any questions for the speakers, feel free to come up to them after, and I'm sure they will be able to talk your ear off. So thank you so much.
Thank you.